We are trying to send a message to families who don't need to necessarily have to come to the emergency department to be evaluated or managed to just think twice.
Montreal's pediatric hospitals are sounding the alarm on overcrowded ERs. Sainte-Justine Hospital and the Montreal Children's Hospital came together on Wednesday at a joint press conference. They say their emergency departments are under pressure from the high volume of respiratory viruses. As the holidays approach, they're reminding parents to avoid coming here if their child's condition isn't urgent. The average occupancy rate at the Children's over the last 2 weeks has been just under 160%, and at the Sainte-Justine, over 172% capacity.
We're seeing children with pneumonia. We're seeing children who are dehydrated from gastroenteritis. So we're seeing the usual picture at this time of year, but we know that with the flu season starting, the volume that we're seeing is going to be increased.
This comes a day after the coroner's office and regional health authorities launched investigations into the deaths of 2 patients waiting for emergency care at the overcrowded ER of Anna Laberge Hospital in Chateauguay on Montreal's South Shore. The situation across the city has been dire.
Part of the reason why we're having a higher occupancy is because we do have a lot of sick children, and there's not enough access to the inpatient units because they are also short-staffed and we don't have the beds that we need.
In the last 2 weeks, patients with minor health emergencies accounted for over half of ER visits at the Children's. Patients waiting up to 6 hours, like Marc Cuisan.
I just have to be patient because it's for my child's benefit.
I expect it could be a long wait. I mean, it's not new. It seems like it's a message that's passed very often. And in the short term, we just have to deal with it the way it is. I mean, hopefully long term, the changes get made that'll improve it.
We feel terribly if families have to wait, but we ask for their support of us to understand that even if it seems like from the waiting room, it doesn't seem like things are happening, there is a lot happening inside the department.
We've gone through difficult years of high volumes. We try to find alternatives and workarounds. But our mission always remains to treat the most sick patients, and that's what keeps us going through these difficult periods.
For non-urgent cases, they advise calling the Info Santé health line at 811, visiting a pharmacy or walk-in clinic rather than going straight to the ER.
If it was something we could avoid, we would. It's never a fun place to be, right? So ideally, we come only if we have to.
In Montreal, Alyssia Rubertucci, City News.